Very much, Cheryl. Well, millions of people suffer with chronic pain and depression. Our next guest is a leading expert in integrative medicine and wrote a very interesting book called Total Recovery, a revolutionary new approach to breaking the cycle of pain and depression. We welcome Dr. Gary Kaplan to Virginia this morning. It's nice to see you.
Well, thank you for having me on the show. It's a pleasure to be here.
This is a life so far's work of study, putting this book together.
Yes.
Very near and dear to your heart.
Very much so.
Tell us what really sparked the idea to finally put all this together.
Oh, I've been working with patients for 30 years and trying to understand why we see so much pain and why we see so much depression in common with each other. About 65% of the people who are suffering with pain and depression will suffer with both. And the treatment success rate is abysmal. If you have just depression alone and just pain alone, probably about 48% chance of total recovery. Okay? If you have both, the odds of total recovery are 10%. So it's abysmal. And the question was, why were we seeing these people not getting better? What was going on with them? What were we missing? And it turns out that there's a lot in common between these two diseases. They're actually not diseases so much as they are symptoms. And what they're symptoms of is inflammation in the brain. It's a brain on fire. And once we understood that what we were looking at is symptoms of inflammation in the brain, we could turn around and say, okay, what causes inflammation in the brain? And then how do we go about fixing it? And then what evolved out of that was an understanding that it's not so much the event, but rather it's a whole series of processes that lead up to that. And in fact, in order to be successful in treating these conditions, we have to treat not the thing, but the totality of the individual. And once we started putting that together, our success rate improved dramatically.
Inflammation of the brain sounds practically terrifying. So immediately you think, what on earth can I do? And you explore that.
We do. And let me back up about inflammation for a second, because inflammation is a very confusing thing. Inflammation is a lot of different things in the body. So that if you have allergies, you get runny nose and you get itchy eyes. And what's going on there is an antigen reaction to pollen. Okay? And that's mediated by histamine in the body. And so what you want to take for that is an antihistamine. If you have a cut, you have swelling, you have redness, you have pus occurring, that's a result of a bacteria infection in the body's response to the bacteria. We wouldn't take an antihistamine for that. That inflammation you take an antibiotic for. In the brain, there's small cells that are called microglia, and they're part of the innate immune system. And what they do is anytime the brain is injured, and there's a lot of things that can injure the brain. So concussions, such as we were talking earlier about NFL players sustain a number of concussions, that incites an inflammatory reaction. So anytime there's damage to the brain, long-term stress can create damaged neurons in the brain. Hypoxia, now hypoxia is a loss of oxygen in the brain. When does that happen? That happens when you go to bed at night for the 5% of the people in this country who have sleep apnea. They lose oxygen to the brain every night. So there's a wide range of things that create the problem, and they're cumulative over time. And then what happens is there's a point at which there's a trip over point and something happens and then you develop into chronic pain. And so we have to think about how we got to the point as opposed to the event that happened that finally tripped us over. So, you know, one of the patients that taught me a great deal was a young woman that came to see me. She was in her teens at the time, and what she did was she had this thing called complex regional pain syndrome that had become a generalized pain phenomenon. Now you have to understand what's going on here. This is a kid who's crippled by pain, all right? And
a lot of folks can identify with that.
Absolutely, absolutely. And so this poor child is completely disabled by her pain. Multiple hospitalizations. She's seen at some of the best medical centers in the country. She finally ends up at Children's Hospital in Philadelphia, where they put these kids through an incredibly rigorous physical therapy program to attempt to reset the pain receptors. Now, I'm not quite sure what that means, but it does seem to work when you treat these kids 7 days a week, having them haul bags and really push through the pain. Eventually, the pain seems to decrease. Well, that was effective for her up to a point. She then comes home, and what starts to happen is fatigue becomes increasingly worse for her. Chronic daily headaches start occurring, and the pain starts coming back. So when we saw her, we said, okay, where did all this start? Well, it started supposedly with a sports injury with a kick in the knee, and that started the complex regional pain syndrome. Now, how many people get kicked in the knee and get completely better and never have another problem?
We have 15 seconds left. You have some amazing stories to share, and this is just the start of it. Dr. Gary Kaplan, thanks for being with us.
My pleasure.
I got to learn more about that, and so do you. Pick up the new book. It's called Total Recovery, a revolutionary new approach to breaking the cycle of pain and depression. It's now available. For more information on integrative medicine, we'll put a link on our show website at WTVR.com/VTM. Thanks to all our guests for being with us today here in Virginia this morning.
Thank you for having me.
Our live show returns Monday right here on CBS 6. Have a terrific weekend.